We have an ACGME certified 1-year Interventional Cardiology Fellowship program. There's an option for a 2nd year of advanced training in interventional cardiology, which focuses more on structural heart diseases and vascular diseases and vascular medicine.
I was looking for a place to train where the cath lab was central to the Department of Cardiology, and I seemed to get that impression when I came to interview here at Beaumont, that the cath lab really drove the department and was the heart and soul of the department, and I think that's important when looking for a place to train.
And I did quite a few cardiology rotations during my residency, so I was able to see firsthand how happy the fellows were here, how supportive the attendings are here, and I had a lot of insight into that before I applied.
The fellows will have an enormous experience taking care of patients with all sorts of acute coronary syndromes, heart failure, acute MIs. We do a lot of supported angioplasty procedures with balloon pumps or Impella.
Being one of the busiest cath labs in the country, it means that not only do you do a lot of cases, but with the assistance of the attendings, you are definitely the primary operator, not only on the simple interventions, but also complex intervention.
As is true with our clinical fellowship, it's a 1 attending, 1 fellow model. The fellows who come for interventional are doing angioplasty procedures from day 1, passing the guide wire, manipulating the guiding catheter, advancing balloon catheters, deploying stents, different types of access, whether it's femoral or brachial or radial access. We use all kinds of access. Fellows are going to get a huge exposure to all of those kinds of things.
We aren't wiping wires in the cath lab. We're doing the work, making the decisions. You know, we have Impella, we have rotoblator, we have CSI, and we get plenty of opportunities to learn those techniques with guidance, obviously.
At this point, you know, I'm a little more than halfway through the year, and you know, I've already met my requirement for the year, which is 250 PCIs. So I say on target for about 1,000 cases total, and I'd say between 350 and 400 interventions for the year.
We're very aggressive about debulking strategies for heavily calcified blockages. So fellows here will all be certified in rotational atherectomy by the time they complete their fellowship training.
You're not a fellow to the attendings. You're truly their colleague from the first day in the cath lab or the first day on any rotation.
Beaumont is a place where not only do we use all the current technology, but we're also pioneers in the field in a sense where we're always looking at the new devices, and we're usually the first in a lot of aspects to actually pursue some of the newer technology.
From a structural standpoint, I'm very fortunate to be exposed to TAVR, MitraClip, Lariat, Watchman, ASDs, PFOs, paravalvular leaks. There's a lot of opportunity for education and training.
Beaumont is a very family-friendly area, and we have an excellent relationship as fellows with all of the attendings and with the staff.
I think that the important thing about choosing an interventional fellowship is not just the total volume of procedures you do, but also the quality of the operators that you work with. And we have world-class operators. I think we get to work with folks who are strictly academic. We get to work with folks who are strictly private practice, and then we work with folks who kind of dangle in the middle. I think that that's important because you can take from each person's skill set.
And you got to want to work hard and have fun doing it. And we lean on each other. We work hard, but also play hard. It's not just work all the time.
If you want to be an excellent interventionalist, then you want to go to a high-volume program with excellent teachers in a wide range of pathology. And I think that's what you get here.
I'd say I love this place. I have no regrets. So if I had to, you know, if I had to do this over 20 times, I'd do it again. I think Beaumont is a place where it's exceeded my expectation. So, I'd recommend it for anyone.
The interventional year is an absolutely fabulous year. Fellows work hard, you do a lot of procedures. It's great experience. And I will guarantee any fellow who comes here for training in interventional cardiology, when they leave this program, they'll be fully confident and fully competent to take care of any interventional problem they face for the rest of their career.